Greetings from Indian Journal of Anaesthesia. I, Dr. Pushpa Pandey, will be presenting a brief communication from Indian Journal of Anaesthesia, August issue. Effectiveness of ultrasound-guided pulse radiofrequency ablation of suprascapular nerve versus local anesthetics with steroids in patients with chronic shoulder pain, a randomized controlled trial. Chronic shoulder pain significantly impacts psychosocial well-being and quality of life. When conservative methods prove insufficient, minimally invasive interventions like intra-articular or soft tissue injections and suprascapular nerve blocks may be employed for patients who do not respond to conservative treatments. This study compares the effectiveness of ultrasound-guided pulse radiofrequency lesioning and local anesthetics with steroid injections for chronic shoulder pain. The authors hypothesized that employing ultrasound-guided pulse radiofrequency lesioning would result in substantial pain relief and functional improvement in individuals suffering from chronic shoulder pain compared to local anesthetics and steroid injections to suprascapular nerve. The study was approved from Institutional Ethics Committee and registered under CTRI. It was a randomized triple-blinded active control trial where patients aged 18 to 80 years experiencing shoulder pain and restriction of movement over 3 months due to shoulder conditions like adhesive capsulitis, chronic tendinitis, impingement syndrome, and chronic rotator cuff injuries with an average NRS of 5 or higher were included. Patients falling out of these criteria were excluded from the study. To detect a minimally clinical importance difference, that is MCID of 2.17 for chronic shoulder pain at 3 months with a pooled standard deviation of 2.0 with an equivalence margin of 0.2 and to achieve a power of 80% with a level of significance of 5%, 18 patients per group were required. The authors recruited 20 patients per group to account for an attrition rate of 10%. Statistical analysis was performed using SPSS 22. The primary outcome was NRS at 3 months in both the groups. The secondary outcomes included assessing the number of patients who achieved effective pain relief defined by more than 50% reduction in NRS at 3 months and measuring a passive range of motion with Babita, shoulder pain and disability index SPADI, and NRS at 2, 4, 8, and 12 weeks. Regarding the results, the mean NRS scores between the pulse radiofrequency group and block steroid groups were similar at 3 months. It was found that the relationship between time and pain scores was statistically significant, but no significant interaction between the pain scores and groups was found. Both the groups showed a significant decrease in NRS scores compared to the baseline. So these are the results where we can see that the demographic parameters were comparable and the pain scores were comparable between the both groups at all time points except for the 2 weeks where the difference was statistically significant. Therefore, the authors observed that both interventions yielded similar pain relief and improved SPADI scores and range of movements. However, it was worth noting that block group exhibited significantly lower pain at single time point, specifically during the 2-week follow-up period. The notable reduction in pain experienced can be attributed to anti-inflammatory properties of the steroid. In contrast, the analgesic effects of pulse radiofrequency lesioning due to its neuromodulatory effects were achieved later, that is around 4 weeks. Therefore, in conclusion, both ultrasound-guided pulse radiofrequency lesioning treatment of suprascapular nerve and bupivacaine steroid groups demonstrated substantial and comparable pain reduction and improvements in the SPADI score and range of movements in patients with chronic shoulder pain lasting up to a 12-week follow-up